area of concern for working class people throughout the country. In addition to that, we're working with the Healthcare for America Now coalition. Their representatives are behind me, as well as you can see representatives from labor unions throughout Western New York.
The rhetoric and the lies are flying around healthcare reform. I am a registered nurse, and I stand here today with my fellow healthcare workers and brothers and sisters in labor to bring the focus back on the real issues and why we can no longer wait for healthcare reform. So let's talk about what we do know. Healthcare is big business. Some of the major companies like Aetna and Cigna, they posted profits in 2007 over $1 billion each. You think you have coverage and don't have to worry? Think again. Until you get sick, you do not know the limitations, restrictions, exclusions, rules that dictate your health care. You see, as a nurse, many people look to us for advice, so we hear stories all the time. Last week I had blood drawn, and I was told a story of a gentleman that retired, developed cancer, and then had a stroke. After he was in the hospital, he needed to go to rehab. They wouldn't send him to rehab because he needed to get to chemotherapy and radiation, so he couldn't go home or go to a rehab center. They then sent him a bill for $28,000 because they said he didn't need hospitalization, but they wouldn't take him in a rehab center. The man worked his whole life, and now he's worried about what he's going to pay, how he's going to pay that $28,000. We are all just one injury, one illness, or job loss, or company bankruptcy away from losing our health care benefits. The average family coverage has jumped to about $12,000 a year, and it's expected to double by 2016.
Why is this happening? We live in the greatest country in the world, yet we have 47 million people who aren't insured. And those who are insured are praying every day that they stay healthy because they can't afford to get sick. And young adults that are graduating from college not only have large debts to pay back, they now have to worry about health insurance expenses. We should not have a price tag on our health. I know this bill will not only help my family and my husband's employer, but I know it'll help millions of families just like ours across this whole country. So please take time tomorrow and call your representatives and thank them for the support of a strong public option. And those who oppose it, call them and tell them why they should support it. Then call the White House and tell the President that we want a bill that supports a strong public option, and we will accept nothing less.
There is a debate going on in this nation about another right, and that is for health care in this nation. The United States spends more than $2.5 trillion a year, more than any industrialized nation for health care. It's 17% of the American economy as measured by the gross domestic product. And 37 countries deliver better quality care than we do. 46 countries keep their kids alive after birth longer than we do. The current system that we are on bankrupts individuals, it bankrupts businesses. Some 800,000 people each year go into bankruptcy because of what's referred to as medical debt. Insurance companies play this game. They play this game whereby people, healthy people, pay their premiums. And then when somebody gets sick, they find a technicality and they cancel your policy. Businesses can't afford it. Individuals can't afford it. The debate in Washington is often very deeply misleading. The solution to this problem is not Democratic. It's not Republican. It's uniquely American. You don't need to look to Europe. You don't need to look to Canada. You need to look right here in the United States. And when I say I support a public plan, a not-for-profit plan, I look at places like the Cleveland Clinic, like the Mayo Clinic, like Johns Hopkins University, that delivers the highest quality health care, not only in the nation, but the world, at the lowest possible cost. That's the health care that I want for my family. That's the health care that I want for my community, and that's the health care that I want for my nation. And every person in this nation deserves high-quality health care at the lowest possible cost. We can decide to do nothing as a nation, but here's what is guaranteed if we do nothing as a nation. In that, health care costs have doubled in the last 10 years and will double again in the next 10 years. So the 47 million people without health insurance today will rise to 50 to 67 million. And these aren't poor folks. Poor people qualify for Medicaid. They get insurance through Medicaid. These aren't older Americans. Older Americans qualify for Medicare. These are working folks from our community that you heard demonstrated today, who get up every day and go to work, but their employers or the individuals can't afford health insurance. So what do? They end up in an emergency room when they're sicker than they otherwise would be if they had access to a primary care physician. And there's something inherently unfair with a nation as great as ours, with the great resources that we had, with the innovation, the technology that we have led throughout the entire world. When we pay a nurse $39,000 a year on average in this nation, when we pay a primary care physician $147,000 a year, and we pay the head of the for-profit insurance industry $24 million a year before bonuses for rationing care so as to reduce medical expenses. We are a nation that shouldn't be 37th when compared to 192 other countries. We shouldn't be a nation that is 46 when compared to 212 other countries. We should be number one. And the people of this nation, the people of this community, and the people of this state should demand it. Don't accept doing nothing. We have an obligation to you and to future generations to deliver the highest quality health care at the lowest cost. And that's what you should think about when you think about a public option. Mayo Clinic, Cleveland Clinic, Johns Hopkins University, they should not be the exception in this nation. They should be the rule. And we're going to deliver a bill that delivers the highest quality health care at the lowest possible cost.